Well, hello everyone, and welcome to today's webinar. Today we're excited to be bringing you some information about diabetes. My name is Dawn Van Dam, and I'm the President and CEO of 1 Million Solutions in Health. So we welcome you to this webinar today. It's entitled How Food Choices Affect Diabetes, and the second part will be about healthy eating and diabetes. We have two great speakers today, and I look forward to introducing them both to you in a moment. Let me just tell you first a little bit about 1 Million Solutions in Health. First of all, at 1 Million Solutions in Health, our goal is to improve healthcare one solution at a time. We can't do everything at once, so this is a good example of today where we're giving everyone some advice and some information about how to improve your food choices and how to help control your diabetes. We specialize in providing information in three areas. One is in the life sciences area. The second is in healthcare, and the third is information particularly either driven by or specifically for patients and consumers. So how we do this is we help people connect. We're helping people work together on initiatives around the globe to improve healthcare, accelerate life sciences research, and share patient and consumer-focused ideas and solutions. We are a community, and we encourage everyone to join our community to help learn and share your knowledge and ideas through events like this or live events that we often hold, discussion forums, articles, and really we're trying to advance the science and bring more information to more people around the globe. So if you would like to invite your friends and colleagues to join us for future webinars or future sessions, just either have them join our database or share this information with them afterwards. We do record these events, and we will be sending it to you afterwards so that you can as well share this with other people. If you have some ideas that you would like to share, though, around the world, if you are in academia, government, if you're an entrepreneur or you have a business, please definitely connect with us, and we'll look for a way where we can share your ideas and your information with other people in the life sciences and healthcare area. We also have a consortium of pharmaceutical companies, and through that consortium of pharmaceutical companies, we also share different areas of science with those people in those major industry companies in order to help tell them more about the different scientific opportunities that exist. So let me tell you a little bit today about the two presentations. The first presentation, How Food Choices Affect Diabetes. What we find is that the most common question people with diabetes ask is, what can I eat? So by better understanding the effects of various foods on our blood glucose, we will all be better able to make good food choices to achieve optimal control of our diabetes. This webinar will teach participants and those who take care of people with diabetes how to make food choices based on their blood glucose readings. We focus on making baby step changes that are practical for today's lifestyle, changes that can become permanent habits over time. In this first section, participants will learn the three major nutrients and their food sources, the effect of each nutrient on blood glucose, target blood glucose and testing guidelines, the plate method, and food strategies for optimal blood glucose control. So I'm going to introduce our first speaker. Our first speaker will be Grace Lau. Grace is a registered dietitian and a certified diabetes educator. She has 30-plus years of experience in nutrition and diabetes. Her experience includes diabetes consulting work, entrepreneurial consulting, clinical research, and dietetics. She specializes in the area of diabetes, cardiovascular health, weight management, and wellness. Grace became interested in diabetes when she worked in research at the University of South Florida's diabetes program in Tampa, Florida. She has been a CDE for 20 years, a certified diabetes educator. She felt so strongly about patients with diabetes that they should have insurance coverage for the opportunity to learn self-management skills that she, along with many other diabetes advocates, went to her state and our nation's capital to lobby for the cause. She is the recipient of the Legislative Award from the American Dietetic Association's Diabetes Care and Education Practice Group in 1996 and the Grassroots Political Action Award from the Florida Dietetic Association in 2000. She has also been recognized for her professional achievements and leadership ability by her peers. Teaching diabetes is Grace's passion, and making it readily accessible to all is her goal. So with no further ado, I will pass the baton to Grace and let her begin her presentation in just a moment. So welcome, Grace, and thanks for participating in today's session. And we look forward to hearing what you have to say.
Thank you, Dawn, for the introduction. Good morning, everyone. Today's topic is how food choices affect diabetes. I'd like to focus the strategies on strategies mostly for folks with type 2 diabetes and not on insulin injections. We will have webinars in the future for insulin users as well. So today we will discuss the food, how food affects your blood glucose and how to use your blood glucose to help make food choices. So let's take a look at the current blood glucose target guidelines. We have two sets of guidelines to use, one from the American Diabetes Association and the other one is from the diabetes specialist, the endocrinologist group. So when we look at the endocrinologist group, they are a little stricter because the group strives to keep our patients' blood glucose near non-diabetic range because according to clinical studies, if we can get our patients' blood glucose near non-diabetic range, it will have much less risk for damage done to their body. So we take a look at how, when we test blood sugars, what numbers to look for. The first line, we have the before meal blood glucose. ADA says 70 to 130, and then the ACE guideline says 70 to 110. So we take baby steps to try to get there if we can. And when we test after we eat, we will usually find out how if we have a before meal and an after meal, we'll find out how the food affects our blood sugar, which is very important to help us make food choices. So ADA says we should have it no higher than 180, so under 180. And when do we test after we eat? It's 2 hours from the start of the meal. 2 hours from the start, meaning if you start at lunch at 12, you test at 2 o'clock. Many of my patients, when we hear after meal blood sugars, they usually do it after they finish and then they count 2 hours. So that is not exactly the best way to do it. So one way to remind us to do the 2-hour after meal test, because we all live in a busy world, so I suggest to my patients is take a look at the time when you start eating, and then you set the alarm on your smartphone or kitchen alarm clock or whatever to go off in 2 hours, and we don't miss that window of opportunity to test to find out how your blood glucose or your food is affecting your blood glucose. So ACE guideline says less than 140. 140 is it's really non-diabetic range. So we try to get there if we can. If not, the ADA guidelines are acceptable as well. So hemoglobin A1C test. Most of my patients know they have to be tested every 3 months. There's a report card going back to their doctor. But most of them don't really know what that test is. It is not really a blood sugar test. It is hemoglobin A1C is the protein in the blood that the sugar sticks to. So if you imagine your hemoglobin A1C are like cereal cornflakes, if there's a lot of high sugar in your circulation, the sugar sticks to the cornflakes, they become frosted flakes. So what the doctors are doing is to try to find out how much frosted flakes you have in the blood. And these cornflakes, this hemoglobin A1C stays in the circulation for about 2 to 3 hours, 2 to 3 months. So this A1C test is an indication of estimated average blood glucose for the previous 3 months. But if you have very high glucose numbers right now, your blood sugar is pretty much out of control, then these guidelines will not be yours to follow at this point. You would be aiming for seeing less 200 blood sugars from 1 week to another, and then less and less, and then later on you will go to aim for the less than 180. We take baby steps to achieve that. Sometimes my patients give up because they keep seeing the 200s on their glucose logbook, and they give up and stop testing, which I don't want any of you to do that. So be patient with yourself. So the good news is, even if you're out of control right now, your A1C may be very high, 10%. Yesterday I had a patient whose A1C was 14%, usually off the chart. But the good news is if you can lower your A1C by 1%, there is enough improvement to lower our risk of damage being done to our eyes, kidney, and nerve damages by as much as 37%. So we always, be patient with ourselves and gradually bring it down. Taking baby steps is what I suggest for my patients to do, so these habits can be changed over time, so we can make it part of our lifestyle. And because we live with diabetes, we have to make sure whatever action that we take is something that is practical that we can live with. So how does food relate to blood glucose? So here you see a chart, and you see typically the dotted line is your normal range of blood glucose, and then after we eat, food turns into sugar, and then you see the blood glucose rise into your circulation. And over a period of 2-3 hours, most of what we eat is digested, and the glucose has gone into the circulation, so the curve will come back down to normal if you don't have diabetes or if your blood sugar is in very good control. So typically, when we eat 3 meals a day, then it will be breakfast, lunch, and dinner. You will have that 3 typical curve. And to look at the blood sugar testing, patients often ask, well, how many times do I have to test and so forth. So what we recommend is for folks who don't take insulin, we suggest 2 tests a day. 2 tests a day, we suggest doing it before and after each meal. So one day you do before and after breakfast. The next day you would do before and after lunch, forget about breakfast. And the third day you will do before and after dinner. And this is, again, 2 hours from the beginning of the meal. You see those arrows? Okay. So, but sometimes our doctors would tell us when to test once a day. Most of the time, my patients will do first thing in the morning, and they forget about diabetes the rest of the day, which is not a great idea. So we suggest even if you test once a day, you want to alternate the times of testing. So you have some kind of form some kind of a pattern and have an idea how your day, as your day progresses, how your blood glucose is running based on the activities that you have or not, and based on the type of food and the quantity of food that you select or not. And for insulin users, the one thing to always remember is it's for safety purposes. You always should know your blood sugar before you do an insulin injection. And most insulin users will test 3, 4, or more times a day, depending on the treatment plan that your doctor has planned for you, and what your needs are to find out how much insulin to take and so forth. All right. So always write them down. Even though all our meters have memory, hundreds of blood glucose numbers, they'll keep track for you. But when you put it on paper like this, you can actually see patterns and trends. And it's always recommended that you bring your blood glucose logbook to your doctor when you go in for a visit. And we all know today doctors don't have a lot of time to study through your logs, and so you want to bring the most recent week, if not more. And perhaps you could even highlight out the out-of-range blood glucose, whether it's too high or too low, to show them where they are. The more information you give them, the better they can help you. So as you can see, this person is testing twice a day, Monday through Sunday. We already have a set of numbers for breakfast, lunch, and dinner. So as the weeks continue on, you collect more numbers. So when you find out there's say there is a pattern that your dinner time, evening blood glucose numbers are always higher than the rest of the day, then just leave the rest of the day alone for now. Don't fix it if it's not broken. So we work on one meal, one segment of the day at a time. That time blood sugars can be randomly tested. If you want to know, say you go out for dinner with your friends on the weekend and you want to know how high your blood sugar is going to be by the time you go to bed, or whether you have made decisions and make good choices at the restaurant, then you want to do a blood glucose test. We always remember as educators and healthcare providers to teach our folks with diabetes what to do when blood sugar is too low. Too low meaning less than 70. And but sometimes we forget to let our patients know what do you do when the sugar is high? So, and I often get that question asked as well. So patients would ask me, well, what do you do when I keep putting the high numbers in the book and it's not helping me? So one suggestion to consider, one thing to consider is just move around, even if it's walking around in your house 5–10 minutes. That's baby steps, but every activity, little bit, as little as it is, it's more than what you, if you didn't move, okay? So just walk around for 5–10 minutes, that's good. And if you can do more, that's even better to help the blood glucose to go down. We don't want you to go vigorously, go exercise vigorously, because if your blood glucose is very high, 250 or not, that is not, vigorous exercise is not recommended. Okay, now let's take a look at how food, the nutrients in food, how they affect our blood glucose. So we find nutrients in food: carbohydrates, protein, fat, vitamins, minerals, and water. So as you can see on this chart, carbohydrates, protein, and fat will affect our blood glucose, and the rest will not. So we focus on these three. And I think everybody, probably almost everybody, will know that carbohydrates makes our glucose to go up. But that does not mean we have to avoid carbohydrate foods. We just need to know when to eat them and how often and how much to eat at one time. So taking a look at different food groups that we usually try to have a balanced meal, we select foods from different food groups. And you have starch, fruits, and milk. And you can see going across on that chart, the effect of blood glucose is quite large because these foods are high in carbohydrates. And carbohydrates is easy to digest, so the rate of effect is fast. And once it's broken down, the glucose is released into your bloodstream, and carbohydrates converts almost 100% to sugar. So you take a look at your sugar-free cookies, for instance, on the label, it may say 0 gram of sugar or 1 gram of sugar. Is always carbohydrates, and all that carbohydrate is going to turn into sugar and make a difference on your blood glucose, all right? So we have to pay attention to all that. Non-starchy vegetables are mostly, you know, salad greens, the crunchy type, or even not so crunchy like carrots like squash and all, summer squash. They have carbohydrates, but a much smaller amount, so the effect is small. Meat and protein like seafood and eggs and cheeses as well. Protein do not make a lot of sugar, so it's a small effect on our blood glucose, and fat even less. So in times of when you test blood glucose before you eat, you can take a look at you know, what you are planning to eat, and you can make adjustments in either in choice of food, the items on the menu, or adjust the quantity based on what your blood sugar is. So some examples of starches: bread, pasta, rice, cereal, legumes, starchy vegetables like potato, peas, and corn, beans. A lot of my patients try to avoid them all. This food group also has good nutrients that you will not be getting from other food groups. So you do need to have some, but not too much. So some patients would say, my doctor tells me don't eat any rice or pasta. Well, the reason why is because when we eat rice or pasta, it's always a whole plateful. And that's the reason, you know, to keep it short and sweet. They say don't eat it. But it's really not don't eat it. It is control the amount. So later on, we'll talk about how much can we have. Fruit is healthy. A lot of people switch from sodas to fruit and thinking that it's better for them. The fruit has natural sugar, so it is 100% carbohydrate. So it will have a great effect on our blood glucose. Milk, the sugar in the milk is lactose. When you look on a carton of milk, you see 12 grams, 11 grams of sugar. It's not sugar they put in the milk. It is the lactose. Even lactose-free milk, the lactose is still in there. They just add the enzyme to help pre-digest that lactose for folks who don't tolerate lactose, right? So these vegetables, the fourth group, going down the list, are the non-starchy vegetables. Non-starchy vegetables that don't make a lot of glucose because they don't have a lot of carbohydrates. And other foods that are carbohydrate foods, of course, is your snack foods, sweets and desserts and soups and all. And when we look at this plate, the easiest, the simplest way to manage our food intake is by following this plate method. And we find patients find it very easy to follow, and it's manageable. it's a good place to start, okay? So this plate will give you half a plate of the non-starchy vegetables, and you put your protein, like meat, fish, and chicken and all, on a quarter, and then your starch on the other quarter. You will be getting a balanced meal. This is balanced nutrition. And remember, the starch makes the most carbohydrate. has the most carbohydrate that makes a big effect on sugar. It is consistent because every time you eat some starchy food, it's a quarter of the plate full of starchy foods. And if you use a smaller plate, like a 9-inch luncheon-sized plate, it will also help promote weight loss. And to start with this, you don't have to make everybody change the menu, and you don't know what to eat to start with. Often patients express that feeling. And so you can still continue with what you eat and adjust. This is quantity control, right? So you allow yourself to eat what you want, you just put it in the right place. And then you can adjust it later on. You move from quantity to quality to in place to replace, improve the quality of this plate. And patients will joke with me, I'll start with a pizza plate, or I will, powder it up high, however you do it, because every person, every adult do not eat the same amount of food, do not need the same amount of food. So you let your blood glucose guide you, and that's the whole bottom line of this webinar, is how to use your blood glucose to guide you to eat. So baby step, meaning do the quantity first, and then do the work on the quality in later on. So some foods that we can put on that quarter of the plate will be potatoes, rice, pasta, all the high carbohydrate foods, along with the starchy vegetables like peas and corn and legumes. And protein, egg is a protein food. Cheese is made from milk, but when you make cheese from milk, most of the carbohydrate is not there anymore, so we consider cheese as a protein food. And vegetarians can use beans and legumes as the protein portion. And then the non-starchy vegetables, some of these are common. There's a long, long list of non-starchy vegetables, and these are just a few examples of common vegetables. If you get very hungry, you feel like you need more food, you can always load up on salad greens, but be careful with the salad dressing. And fruits and dairy, they're not on the plate, so what do we do with them? The average adult should have 2 to 3 servings of fruit a day and 2 to 3 servings of dairy products a day. And what is a serving of fruit? We think of a tennis ball size fruit or fresh fruit. If it's mixed fruit, half a cup serving. And again, let me remind you that fruit, whether you buy juice or packaged fruits, they will say no sugar added. Even if they say no sugar added, fruit itself has sugar. So be very aware of the carbohydrates in that packaged food. And always try to eat fruit rather than drink juice, because a serving of juice is only 4 ounces to swallow, and it will, because it will raise your blood sugar quickly. It's not a good idea unless if you're having low blood glucose reaction. Dairy products, 2 to 3 servings of dairy. We don't only get protein from dairy, we get calcium from dairy. So if you do not like dairy or lactose intolerance, do not use any dairy, you don't have to worry about that, and you just take a calcium supplement. Go to your pharmacy and find out how much you need based on your age and where you are in your life cycle, and then you can find out how much calcium you need. Most calcium products on the market now are fortified with vitamin D as well to help you absorb that calcium. So pharmacists can give you more detailed information on that. So that's the fruit and the dairy, and we can have it as part of the meal. For instance, you can have a sandwich and a piece of fruit, or a glass of milk with dinner. Or you don't have to have it at the same time. You can split it up into snacks. For breakfast, of course, we won't make you eat vegetables for breakfast. Some cultures do eat vegetables for breakfast, but for us, we're looking pretty much half of a plate of starch and protein. So some examples of protein could be the egg, like you see on this slide. It can be peanut butter on toast. It can be melted cheese. You can make cheese toast, omelet, and you don't have to eat eggs every day. The recommendation is 3 to 4 egg yolks a week. You can do more egg whites if you like for protein. Or you can have a bowl of cereal with milk. If you always have a banana with your milk and cereal, then you may want to do your blood glucose test before breakfast and after breakfast to see, because banana is very starchy and high carbohydrate, even though it's a good source of potassium. Most fruits and vegetables have potassium anyway. So you use your judgment based on your blood glucose to see how much of that you can have. So here are some variations, options for us based on our blood glucose. If you happen to be testing your blood glucose before you eat your meal, and your blood glucose range before meal, we say 70 to 130 based on ADA, or 70 to 110 if you're already there. And if your number is on the lower side of the range, the blood sugars is like blood pressure, it doesn't stay still. So you always have a range. Any number between those two numbers are good, within the range of good numbers. So if you have an 85 or a 90 before you eat dinner tonight, you might decide that, okay, I can splurge a little and I'll eat a little more starch. So the plate doesn't look like the quarter and half now. You can, shift that line a little bit to have a little more starch if you like. And of course, the other side, the other end of the pendulum also happens, and if your blood glucose for some reason happens to be higher on the range, then you might decide, or even over the target blood glucose numbers, then you may want to say, okay, I'm going to go easy on the starch and have a little more protein. I can tell you to eat more non-starchy vegetables, but that doesn't quite satisfy small people. So I will be realistic and say eat a little extra protein, maybe an extra half a piece of chicken or fish or something, and less of the carbohydrate. So whenever your sugar is high before you eat a meal, and of course we're talking about type 2 diabetics who are not adjusting their insulin based on their food intake, okay? So if you always eat a little less or adjust your plate based on your pre-meal blood sugars, before you know it, you'll be ahead of the game. You won't be chasing after that high sugar like some people get so frustrated because no matter what you do, the short numbers is always showing high. So this is the type of meal planning method that we like to see folks to start with. And then, of course, there's always the carbohydrate counting and for insulin users, the carbohydrate insulin ratios and all that we can talk about in future webinars. But for right now, this is a good place to begin. And without, we cannot leave without talking about this food label, nutrition facts label. There's a lot of information on here. We can probably make a webinar out of learning about this nutrition facts, but we won't do that today. And what I'd like for you to focus on is right around the middle of that page. If you're not used to looking at nutrition facts, you will see the word total carbohydrates, 14 grams. So that is what will affect your blood sugar. For most folks, they don't have to be exact counting carbohydrates, so we don't have to subtract fiber, or if you use sugar-free food, subtract the sugar, alcohol, and all. Just use the total carbohydrate. And one serving of carbohydrate is 15 grams. So you see the 1 gram of sugar. That sugar gram is indented under the total carbohydrate, so is the dietary fiber. So both of those are part of the 14 grams already. So when you look at the 14 grams of carbohydrate, you are not ignoring the sugar part. It is already there, included. But if you only look at the sugar gram, 1 gram, this food is very good. It only has 1 gram of sugar. But little do we know, there's the carbohydrates that will raise our blood sugar. So always focus on total carbohydrate. Something that we want to read before total carbohydrate is the serving size. Up here on the top, serving size is always the pretty much following the nutrition facts, the 2 words nutrition facts, and serving size for 1 ounce on this label, so we know how much to eat. Even amount boxes of cereal, all the serving size are not the same. Snack foods like potato chips and pretzels and all, they don't all have the same portion size. And don't let the size of the bag fool you, because some bags can be very small and they serve 7 servings. So very misleading. And all these numbers that's on the left-hand side of your nutrition facts label represent amount per serving. So you can always eat whatever you want by adjusting that serving size. And this is what we mean by, there's nothing really you cannot eat. You just adjust the quantity. As long as we follow good, healthy eating habits most of the time, and once in a while we can enjoy and have something that we like, that's good enough. And then your blood glucose will tell you. I tell my patients, your blood glucose meter is your best friend. It tells you how you're doing when you're doing it right, when you're not doing it right, and it helps you make good decisions. So as a dietitian, we always tell our patients there's no good food and bad food. It is good choices and bad choices. So for those of us with diabetes, we need to look at what kind of choices we make, and using your blood glucose to help you is the best way to start. So remember, there is nothing you cannot eat because of your diabetes, and if you happen to be a sweet addict or something, I still don't take everything away from my patients. I just say, okay, allow yourself one serving of what I call empty calorie food. Some people's weakness is not sweet. It may be salty potato chips, something that is snack food that's not so healthy. If you allow yourself one serving and a day, that will be fine, because that will keep you from feeling deprived down the road, and learn how to control that. So what is one serving? It's 15 grams worth of carbohydrates, and calorie-wise, I would say keep it to 100 to 150 calories for that one snack. One a day, it's not going to kill you, and it's not going to ruin your diabetes control. But as long as you know you can have it, believe it or not, down the road you're going to say, I can eat it or take it or leave it. It's not such a big deal anymore. Many of my patients over the years have told me, Grace, I don't really eat sweets. I never really care for sweets until my doctor tells me I have diabetes. Then it seems like all I think about is sweets. That's being human. You know, deprivation can cause you to want something because we took it away from you. So don't let that happen to you. Allow yourself one little portion if you want to. You don't have to start if you feel fine with whatever you're doing and avoiding the sweets most of the time. And so it is not what you can eat or what you cannot eat. It is what you eat, when you eat them, and how often. So when it comes to foods that are not so healthy, we just don't increase the frequency. You know, we just eat less and less and have it once in a while so we don't feel deprived, and once in a while anything is okay. All right, so last thing I want to leave you with is the idea of baby steps. We often ask too much of ourselves, and we like to be good and have good blood sugar control by tomorrow. We like to lose 30 pounds by next month, and we all know this is what we want, what we like, but it's not realistic. So always have to remind yourself, take you back to reality, baby steps. As long as you're doing a little bit more than what you did yesterday, you are improving health and you are improving your blood glucose if you follow the blood glucose to guide you. Okay? All right, so I guess if you have any questions, Dawn, I'm going to give it back to you now.
Great, thanks, Grace. So Grace, we really appreciate your slides and your presentation and your information. But just before I turn it over to our next speaker, I just wanted to ask you one question that has come in. And I'll just remind everyone that if you do have any questions, just send them to the host via the chat box. So Grace, what you mentioned earlier was that people should start timing themselves after they've finished eating, and they should wait 2 hours. They should set a clock or something like that. But someone asked the question, what happens if it takes me 1 hour to eat my lunch? Should I start the clock at the beginning of when I eat, or should I wait until I finish eating?
No, you should always start the clock from the beginning when you first start eating. And if it is, if it is a 1 hour, very long duration meal, then when you do your 2 hour test, you have to pivot a little and understand that, okay, this could be 1 or 2 hours because my carbohydrate food has not gone in within that first hour. So, the number you will be looking at would be 140 or 160 blood sugar numbers. So it's not carved in stone, but as long as you start doing it, you will find where you are and how the food that you eat affects your blood sugar, and you have an idea.
Okay, terrific. Well, thank you, Grace. So I'm going to turn it over to our next speaker. Thanks. I'm going to turn it over to our next speaker, but first I'll just do a bit of an introduction about her talk and tell you about her background. So our next speaker will be Jareen Schmidt, and she's going to be talking about healthy eating and diabetes and a new tool. So she's going to be talking about the My Diabetes Success app developed by Choices and Patterns, which focuses on the individual by providing an easy-to-use, affordable solution to improve blood sugar control and prevent complications. Through the use of sophisticated rules in this new tool, this app makes it easy for you or the people that you're taking care of that have diabetes. My Diabetes Success, the app, is effortlessly providing insight into one's patterns and outcomes to help people take back the control in their life. The choices, habits, and behaviors are combined in the app to show you the patterns in your life. These patterns can then be used to guide future choices. These future choices eventually become habits and behavioral changes which improve your blood sugar control and make your life easier. The My Diabetes Success app provides a unique and critical real-time solution to self-report information. High, low, and wide swings in blood sugar patterns help to inform and guide a person so they can quickly respond to and resolve less than optimal blood sugar patterns. So I'm just going to give a brief introduction of Jareen and then turn it over to her. So just one second here. Okay, so Jareen Schmidt has spent the last 36 years with a professional and personal focus on the management of diabetes. Her daughter was diagnosed at age 10 with type 1 diabetes, and she has type 2 diabetes herself. Her professional nursing career in diabetes spans clinical pediatrics in diabetes to clinical research and pancreas transplant program management at the University of Minnesota. She expanded her career into the business field of hospital information systems, where she was a principal systems analyst and director of knowledge engineering. The latter position was for a startup company designing a national computer system to connect clinical research scientists and community practicing physicians. Jareen founded her first company in 1990 to advance the use of telephone-based voice interactive speech technology in capturing patient information and speed up communication with the physician healthcare team. With Nelson Hazeltine, CEO and Chief Technology of Choices and Patterns, Jareen co-founded the organization to create and market My Diabetes Success on the iPhone, iPad, and iPod Touch. Choices and Patterns has a core team of healthcare professionals with greater than 35 years of clinical and research experience in diabetes, from pediatrics to program management in diabetes and beyond. So with no further ado, I'm going to pass the baton over to Jareen and let her tell you about this app, which actually is right now free. Over to you, Jareen. Oh, 1 second. There we go. Jareen, I think you just need to be unmuted, because if you're speaking, we can't hear you right now. So just to the right of your name, it looks like you just unmuted yourself.
Dawn, can you give me the ball, too, for the slides?
Yes, you have the ball for the slides, and we can now hear you. So you're off to the races, Jareen.
I'm sorry, I don't see the ball.
You don't need the ball. You just press the arrow up at the top.
Okay, thank you. All right, thank you, Dawn, and thank you to all the participants who registered for today's webinar. To just give a brief history of why we focus on patterns today in the management of diabetes. We used to chase individual blood sugar readings, and what we did was create bouncing blood sugars for people with diabetes, which made them not feel well and so forth. So the idea and the method of managing and treating diabetes using patterns has now been used for the last several decades. What we are doing with Choices and Patterns and My Diabetes Success is taking it another step forward. And what we're doing with patterns is introducing a method through Diabetes Success to correlate the timing and the coordination of food, exercise, activity, medications, and their combined impact on blood sugars. And these are visual methods that one will be able to see in the Patterns module. And I'll explain shortly how those modules look and how they work together to give the visualization of patterns to an individual once they enter their data and information. So we'll go to slide number 1. So the key to a healthy life with diabetes under control. How can one stay healthy living with diabetes when diabetes is a progressive disease over time? Many people don't understand that diabetes is a progressive disease over time, and so they lack the proper attention to keep themselves healthy as they age across the decades. The key to a healthy life with diabetes is healthy eating habits. That is, nutritious meals and snacks, also called nutrient-dense foods, which Grace just talked about. Grace just gave you excellent information on how food affects diabetes and blood sugar control. The challenge of daily diabetes management is timing and coordinating the relationships among food, exercise, activities, and medications, because combined they determine blood glucose patterns and control. So we're looking at both the patterns of your daily choices, habits, and behaviors, how those accumulate across time to then be able to look at your patterns of blood sugars and your control. So for our purpose today, we're focused on food choices that affect diabetes. Exercise, activity, and medications will be addressed in the future webinars, and we'll tie them together with food. Managing diabetes every day is complex, and it takes time to learn as one lives with diabetes. So as Grace has mentioned, baby steps are valuable in understanding oneself. The thing that My Diabetes Success supports is learning how to manage diabetes at your own pace. You're not being pushed by some outside force other than what you can afford to do or you can manage to do at your own pace. So what is a pattern? So the definition of a pattern is all daily blood sugars combined, day in and day out, make up a pattern. And so the focus is on a pattern, not isolated or single blood sugars. Patterns deserve special attention when they are high, low, or you have wide swings between high and low blood sugars. These are called outliers and are associated with an adverse event. An outlier pattern is 3 or more blood sugars outside your personal blood sugar target range prescribed for you by a doctor. Adverse events are contributing causes of high and low blood sugars or wide swings between high and low. 3 outliers may be a pattern within a 24-hour period, or 3 days at the same time each day, or 3 days of random outliers. Examples of common causes of adverse events may be too much food with high blood sugars, too little food with low blood sugars, medication errors, too much or too little exercise. Again, too much may be low blood sugars, too little exercise would be high blood sugars. Other causes would be illness, stress, trauma, and infections, among other causes. Systemic complications. The goal in using My Diabetes Success is to prevent systemic complications that affect the heart, eyes, kidneys, nerves, and the brain. These result from patterns of frequent high and low and uncontrolled wide swings in blood sugars. And recently, there is much more research and focus on the relationship of high blood sugars to damage to the brain. So the key words are patterns and frequent. If one can stay within a prescribed blood sugar target range about 85% of the time, that will help prevent early onset of complications. And a common misinformation is that complications are more rapid in onset in type 1 diabetes. This is not true. In fact, type 2 diabetes is sometimes not diagnosed until symptoms of complications drive an individual to see a doctor. The fact is that complications are equally rapid in onset in all types of diabetes. It's not the type of diabetes, but the frequency of out-of-control high and low blood sugars. According to findings from recent clinical science research, wide swings between high and low may be the cause of serious systemic damage including the brain. So more research is now focusing on the relationship between blood sugars and the brain. One hypothesis is that higher blood sugars beyond 115 may be a precursor to early onset dementia and Alzheimer's disease. So if you recall Grace's graphic or slide where she talked about the two AACE and the American Diabetes Association, they're different ranges, and that the AACE is much stricter than the ADA. So these tests or these this research is looking at blood sugars even beyond 115 may be a precursor to early onset dementia and Alzheimer's disease. So more research now is focusing on the relationship of blood sugars and damage to the brain. So back to staying healthy with diabetes. What is one of the best self-management strategies to be aware of to control blood sugar patterns? Well, the answer is being able to see what you are doing. You can't change what you can't see. A quick and easy strategy with smartphones today is to download an app that supports self-reporting to document your blood sugars before and after meals, as well as with exercise, activity, and medications. So let's talk then about My Diabetes Success app, which Don gave you a nice introduction to. It is a unique management and blood sugar control tool. And I say that because there are over 500 blood sugar programs, apps on the internet. So why do we claim we're unique? The design of My Diabetes Success came from 35 years or more, by Dr. Stephen Duck, who is our Chief Medical Officer, myself as a clinical practitioner. The design came from listening to patients, working with them with diabetes management over those 35 or more years to see why are people having difficulty with managing themselves, why the high A1Cs, why the high blood sugars. So whether a person, let's talk about what the app provides. It provides automated self-reporting in real time. The system itself provides automated tracking, monitoring, documentation, and immediate synthesis of the data and the personal information that you enter. The app will immediately let you know if you are having patterns of frequent high and low blood sugars or wide swings between high and low. Again, these patterns are called outliers because they are outside the blood sugar range considered safe and prescribed by a doctor. So the value is that one can see the reflection of daily management in their choices of foods, eating habits, and behaviors that determine blood sugar patterns. And I'll step you through how the system does that in the next slide. So whether a person, let's go through, the point too about the app is that you will be able to see your data in visible patterns, and it makes it easier to interpret what it is that you might need to change or adjust, and it gives you immediate access then to actionable information. So let's go to the 3 modules of My Diabetes Success. So in the settings module, you enter your actual data. In other words, your current health profile. What is your prescribed blood glucose target range, your blood pressure, your cholesterol, your weight, your BMI, the type of diabetes that you have. And that's the actual profile. The targets is a section where you can put your target goals if they need to be different than where you are in your actual data. So the settings module is your history. It goes forward to the glucose module. So when you enter in real time data and information related to your blood sugars. So in today's release, number 1 that's free on the internet, If you enter a normal blood sugar, then you're done. You don't have to enter any more data. If you have a high or a low blood sugar, with a high blood sugar, it will step you through a pathway, and they're color-coded so that you know you're still in that pathway. And it will, once you enter the blood glucose reading, if it's high, it will want to know, do you have symptoms? It will ask you the causes that you think were for the high blood sugar. What treatment? If you did any treatment, you have the option to say yes or no. What treatment, you enter the treatment, if it was a medication, whatever, and then you enter the results and the timing. So after you treat the high blood sugar, then you can go in and enter the results and the timing when you finally were able to get back into your blood sugar range, your prescribed range. So once you enter in that data, you can immediately go to the patterns module. And the patterns module, again, is immediate information feedback. It takes all of the data from the settings module and the glucose module, synthesizes those, not analyze, but synthesize, correlate them together. And you'll be able to see your blood glucose patterns correlated with choices in food, activity, exercise, and adherence with medications. You can also see what your metabolic control is over time, which means what category of A1C are you in? Good, fair, poor, or very poor. So let's see how you do this. So you go into the first module, the second module, which is the glucose module, and it has a spinner. And the date will come up once you enter your blood glucose reading and the time frame. So if it's breakfast or lunch or whenever. And once you enter those, then the date and time comes up. Now you can always go back to enter in information if you forgot or you were someplace where you couldn't enter it into your iPhone, iPad, or iPod, iTouch. You can write it down and then enter it later, but go back into the time frame in which the blood sugar was taken. So you use the spinner to enter the blood sugar. And then you hit next. And if it's high, again, it will take you through the pathway for high. It also gives national standards of care pointers. So for each level of blood sugar, 200, 300, 400, 500, it will give you advice on what to do, which is usually contact your team or go to the ER. It does not give medical advice. So then you can go to the, and to mention low blood sugar. Low blood sugars are always a medical emergency. So you don't stop to enter your data as you're going through the medical emergency. You always enter low blood sugar data after the fact and after you have returned to a normal blood sugar range. So then you can go to the patterns module, and the patterns module keeps track of how often you are high and low and will tell you the percent. And they're color-coded, so normal is blue, high is the orange or red, and the purple or violet is low blood sugars. So you'll immediately see how you are managing by the percent of times you're in high, low, and normal. You can then go below and look at all of your glucose reading details, tell you the time, symptoms details, if you had any cause details, when they were high or low, treatment details, and the metabolic control takes a monthly view of everything that you were doing. So if you had to go to the ER, you had extra doctor visits, it will tell you how many times you were within range before you ate, how many times you were out of range before you ate, that kind of information. The pattern visualizer then allows you to be able to do 24-hour surveillance, especially if you're ill, you're stressed, whatever, and it will correlate your blood sugars with whatever is causing the out-of-range blood sugars. And so you can see that the AM clock and the PM clock, and again, you can look at both of them. That gives you a 24-hour picture of what has been happening. And it will tell you when there's an outlier, if it was an error in medication, if it was too much food, and so forth. So it helps you to see joined together what the causes may be that you need to look at and possibly change. So the importance, benefit, and value of patterns is the power of habit. The point is to develop the powerful habit of reporting frequently enough to see, evaluate, and guide food choices based on seeing their effect on blood sugar patterns. And also, you want to be consistent in entering data. As Grace said, do breakfast one day before you eat, and 1 hour afterwards would tell you the peak time of food on your blood glucose. But within 2 hours, usually digestion of food within 2 hours has happened. And at 2 hours, you should be back within your target range. So using a habit of entering your blood sugars and then entering always when you have a low blood sugar will give you a more accurate visual pattern of your patterns from being able to see in the patterns module what you've been doing. Patterns provide the basis for seeing, guiding, and deciding what food choices and portion sizes best achieve one's prescribed target blood sugar range most of the time. It's a fact. You can't change what you can't see, and memory alone isn't up to the job. And unfortunately, so many healthcare professionals in working with people with diabetes have to rely on false memory. If you try to reconstruct something that happened weeks ago, months ago, it is of no value to the doctor and the healthcare team to try and tailor and personalize your care. They have to do best guesstimate. So Grace also identified the categories of food choices that can achieve knowledgeable and competent habits of self-management of food and blood sugar patterns. Becoming comfortable over time using My Diabetes Success promises to make daily management easier with increasing confidence, competence, and growing independence in self-management. In other words, learn to be independent, but also at the same time have a very positive collaborative relationship with your healthcare team because they're there for you when you need them. And particularly if you get tired of taking care of diabetes, you burn out, the danger is going into depression. So there are resources for you to be able to reach out to your team and also go on to websites, which I will show you some of those resources shortly. So you have the power to receive personalized care by keeping accurate records and sharing them with your healthcare team and your doctor. Another value of this product of My Diabetes Success is to be used periodically by people with prediabetes and metabolic syndrome, and there are 89 million people in the U.S. alone who are pre-diabetic and have metabolic syndrome. So it's an opportunity for prevention and delay of onset of diabetes type 2 to use My Diabetes Success. And just for people without diabetes, the system in release number 2, which is coming to the market in a few months, they will be able to enter their data without a blood sugar, their food, their activity, exercise, any meds, and so forth, just to try to achieve lifelong healthy blood sugars. So the resources for individuals and families managing diabetes, there's a list here, and of course you'll have those when the presentation has been sent to you via email. So you can access those. Those are available in addition to your doctor and healthcare team when falling off course and you need to veer back on course. So with that, Dawn, I hand it back to you.
Great. Well, thanks, Jareen. We really appreciate your presentation today, and We've got a lot of great questions that have come in, so I'll start them off shortly. And I just want to let everyone know that in the chat box is a short 5-question questionnaire that we'd love you to fill out to give us feedback on this presentation and give us some ideas for future webinars. So please feel free to look for that in the chat box and answer it while you're listening to the Q&A that we're doing right now. So I know that neither one of you, Grace or Jareen, are a physician, but we have sort of a question that maybe you could talk about in general terms, because I know that each person's answer for this question is an individualized answer. But the question is, for patients with uncontrolled blood sugar, is it right to increase the dose of the drug or regulate the food choices?
Answer that.
Jareen, you want to
Sure.
take that? Okay.
Yeah. That is medical advice, and what we offer you is the opportunity to capture the data around that kind of pattern and take it to your healthcare professional, because they will have to figure out among the three, the timing and coordination of food, medications, exercise, and activity in relation to your medication that you're taking and the impact on blood sugars. Which one of those might need to be adjusted? Is it one that needs to be, two that need to be, or three? All three need to be adjusted in order to hit your target pattern, so, and your target blood sugar range. So it might be that you have too much food, too little exercise, and your medication dose is, if you're on insulin, for instance, needs to be increased or lowered. If you're on oral meds, same thing, the oral medication may need to be changed from an oral med to an injectable for type 2, that's type 2. So, and of course, people with type 2 can also be on insulin. So is that a satisfactory answer?
Sure. Thank you very much, Jareen.
Don, I do have one thing to add, please.
Okay.
In terms of food, then I just want to make sure our participants are aware that no matter how high the blood sugar is, when it's time for them to eat a meal, they should not skip a meal, because they might be taking medication that will be working throughout the day. And so that's a fact that I want to bring up, that they make sure they don't skip a meal. We can eat a little less, or like I mentioned in my talk, that, you know, we can adjust the type of food we eat, but don't skip a meal. Thank you.
Great. Well, thank you, Grace. Actually, Grace, here's a question for you. When is the best time to test blood glucose?
Well, that's a good question. I usually tell my patients, when you want a piece of information, then you test. Very often, patients are very obedient and they follow the directions from their healthcare practitioners, and they would do the test and they put the numbers even, go as far as putting the numbers in the logbook. But if they don't haven't been taught or don't know how to use those numbers, then it's kind of wasted effort, in my opinion. So, you know, if you go out to eat at night, you want to know how your blood glucose is before you go, so you just go ahead and randomly do a test. So that will help you to decide when you're at the restaurant, should I eat a pasta dinner, or maybe I should go easy on the carbohydrates and what's, you know, and so forth. So it's when you want to use that blood glucose number to offer you ideas of what the next choice is going to be. It doesn't always have to be food. It could be activity. If I want to eat a little more, if I decide that, okay, I'm going to go for a walk after the meal, then certainly you can do that, and that will help lower the blood glucose as well.
Okay, great. Thank you, Grace. Jareen, here's a question. Sorry.
Oh, Don, let me just say, too, for people who engage in really intense activities and exercise, such as soccer, you know, sports, swimming, and so forth, to take your blood sugar before, sometimes during, and then after those kinds of intense activities, in order to see, you know, what the dose of insulin, if they're on insulin, and whether they need snacks before engaging in the sport, during the sport, or after. So, sorry, go ahead.
That's a great suggestion.
Great. So, Jareen, I'm going to start this question with you. Why will my doctor want to see my patterns?
Because they treat patterns. And doctors, with the new regulations of meaningful use stage 2, as well as ICD-10 coming, they are being required to manage patients, not just see them episodically. And the challenge to manage people with diabetes, especially for primary care practitioners who are very busy doing multiple things, they're not focused like an endocrinologist, the patterns will really help. And they have to be accurate. If you don't take accurate information and data to your healthcare team, it doesn't really help them that much. And you don't have the power to get personalized, tailored care that's accurate and point on for you.
Okay, great. Well, thank you very much. Grace, did you have anything you wanted to add to that question?
It's good. Thank you. I don't have anything to add.
So, Grace, a question for you. Do I have to avoid all white foods?
White foods usually means refined, foods that's made from refined flour, like your breads and crackers and perhaps pasta and things like that. And it is really not the color. People always say, eat the brown, don't eat the white. But all brown is not always better than the white, and all white is not always worse than the brown. So we need to kind of look a little further to see what that particular food is actually made of. The key factor in this, choose foods that are higher in fiber content that will help. And when you do have, foods that's made from whole grains, then you will have the bran in the whole grain because it's complete, it's not refined, then you will get more benefit. I always think of fiber as a bonus. It's not that all patients with diabetes have to have high fiber, but whenever possible, it will be good because it will help slow down the blood glucose rise. And also, whole grains usually have more vitamins and minerals, and it helps to make a person feel fuller because it's bulk. So people don't have to feel hungry after they eat if they're reducing their food intake. And soluble fiber will also lower cholesterol. So it's all good. But be careful with, people say multigrain or whole grain. It may not be 100%. So we use the guideline usually is to look at the nutrition facts label and look at grams of fiber. 3 grams or more is considered high fiber. Food manufacturers actually cannot label a food high fiber unless it is 5 grams or more. So I would encourage our listeners to look at grams of fiber rather than white or brown. In whole foods like fruits and vegetables, then we're looking at, of course, more colorful fruit or vegetable is, the more nutrients there is. So, you have, there's some truth to that. Say, if you do lettuce, iceberg lettuce is very light color, and then when you do the baby kale now, it's a popular thing in this country now, and the darker green like spinach and all will have more nutrients. So just in general, more colorful it is, it's better. But for processed foods, food packages, then you look for the gram of fiber.
Great. Well, thank you, Grace. And Jareen, did you have anything to add to that?
No, that's an excellent answer. It's all of the recent research I've seen on white versus brown foods, particularly in bread. Yeah.
Great, thank you. So I just encourage anyone who has any further questions, and I have just 1 or 2 more questions. So Jareen, this one is for you. How can you use the My Diabetes Success app to capture your blood sugar patterns without getting tired of capturing your patterns?
When you get tired of managing diabetes, and many people do, you should talk to your healthcare team, go to the resources that are on slide 7, because they are designed to particularly help people who are just really tired of managing diabetes day in and day out. And, it is complex, it is demanding, and getting tired of it, becoming depressed about it is very normal. So reach out to your healthcare team or go to resources like those on slide 7.
So this is the slide that you're referring to, I think. different message boards, different websites that you can go to, and different ways to get, you know, inspired to learn more. I think the My Diabetes Success app also is a visual representation of things that you can sort of see, you know, what's happening with your life and understand, you know, what changes you might want to make and what the patterns are. So that hopefully will keep people interested in, and it's new and different on the marketplace. So I'm looking forward to getting more and more people to utilizing it.
Yes, and you're right, Dawn. It's got the anticipatory care model, if people have heard of that. So anticipatory care is embedded in the app so that you can anticipate you're trending the wrong way. So you can stop it before you're going to get into trouble. Sorry, go ahead.
No, super great, thank you. So I'll just remind everyone that the survey is still up. If you have a moment to take a look at that and answer the questions, we would certainly appreciate it. And it looks like we don't have any further questions, but I'll just maybe turn it over to both Jareen and Grace for closing comments. So over to you, Grace, first, for anything that you'd like to say in closing comments in today's webinar.
I just want to say I appreciate the opportunity to share some information regarding how we manage our diabetes and control the blood sugar using the options of making good choices of food. And I hope you feel that it can be done, and I hope you know, you feel that it's never easy, because you know, we cannot quit eating, so we have to eat and we have to look for easier strategies. Start out with the simplest way to make changes. The simplest kind of habit changes becomes when it becomes your habit, you can move on to more difficult ones. So baby steps is what I promote all the time, and I hope you will. If you don't remember anything I say, remember baby steps, okay? Thank you.
Great, thanks, Grace. And over to you, Jareen.
My final comment would be that physicians and the healthcare team benefit from patients sharing their patterns to collaborate in decision-making and an action plan using accurate data to more easily personalize and manage complete, consistent, and continuing care. And that's the challenge in the healthcare field today, is complete, consistent, and coordinated continued care. So the data in My Diabetes Success lends the power to the individual with diabetes to lead the healthcare team in getting personalized care tailored to their specific needs. And that's because the team, the individual educates the team about, this is who I am as a unique individual. And until you can offer them accurate data, they have to do best guesstimate a lot of the times to understand who you are, what you need, and your living circumstances.
Great. Well, thank you very much to both of our speakers today, Grace Lau and Jareen Schmidt. We welcome you to attend future webinars for all of our participants today, and we welcome your feedback through the survey.
Thank you, everybody. Have a good day.
Thank you.
Thanks.